Welcome, everyone, to the Best of Markham podcast, brought to you by me, Igor Klibanov from FitnessSolutionsPlus.ca, your personal trainers for chronic conditions. Here with me today is Salima Jiwani from AudioSense. Salima, tell us a bit about yourself.
So my name is Salima Jiwani. I am an audiologist scientist. I'm the owner of CEO of the clinic's AudioSense Hearing Balance and Concussion. We currently have two clinic locations, one in Markham and the other one is in Toronto. We've had our Toronto location for about 8 years, and our Markham clinic is only about a year and a half, so it's still a baby, but it's growing beautifully. Before owning my clinics, I worked as a clinical territory manager at Cochlear, a cochlear implant company where I helped to support clinicians and patients with cochlear implants. And before that, I was at SickKids, the hospital for sick children downtown Toronto. And I actually completed my PhD at the University of Toronto. And during my PhD, I worked in the cochlear implant program in the audiology departments at SickKids. And I actually completed my PhD working with children who were deaf from a very young age, usually when they were babies, and used a cochlear implant to hear. And we kind of mapped areas of the brain to try to understand how their brain worked and whether there were areas that responded differently to sound.
Oh,
Um, yeah.
very interesting stuff. So you've had a long history with audiology. How'd you get into it in the first place?
So my grandmother, actually. So she was a beautiful, beautiful woman, but she had a ton of health issues. I don't remember her ever not complaining about a pain or another in her body.
Yeah.
And one of the issues that she had was that she had significant hearing loss. She had developed this profound hearing loss later in life,
Mhm.
likely as a result of a lifetime of medication. And we didn't even know that medications could actually cause hearing loss.
Right.
Some genetic factors and age probably played into that later in life. But she never really had a good audiologist, somebody that could kind of educate her and tell her about her hearing. And I
Mhm.
always felt like, when it comes to healthcare, as a patient, it's our body,
Right.
and it's important for us to understand it. And a lot of the clinics were very just interested in selling her a hearing aid, which 100% was the right thing to do. It's what she needed, but she
Mhm.
never understood why or how, what was going on, how to work it better. Was there anything that she can do from a brain or a rehab perspective, to be better? Was there any therapies? And so I felt that there was always a gap in audiology, and I wanted to fill that, and just kind of do full service audiology and really empower my patients with knowledge.
Interesting. So it sounds like you do not just hearing aids, but also some kind of brain-based exercises, as well as patient education.
Exactly. We book a lot of time with each of our patients, and we really take the time. We'll do a comprehensive assessment, regardless of what their issues are. With audiology, we often talk about hearing loss,
Mhm.
but audiologists deal with so much more. Hearing loss is definitely one of them. We absolutely sell hearing aids, but we also work with people who have tinnitus, which is ringing in the ear, sound sensitivities, auditory processing concerns, which is where you have completely normal hearing and that yet you go in a loud restaurant and all of a sudden you feel like you can't understand anything. You're watching TV, your hearing is normal, but you need to turn the subtitles on. Those are very, very real issues for people of all ages, and it's one of the things that we work at. And we've developed some very strong protocols at our clinic. And so we love that we can kind of do full service audiology from that perspective.
Very cool. No, I think my hearing is great, and my English is just fine. But I always turn on the subtitles, even with a show where people don't have an accent.
Yeah.
So interesting. Why might that be?
Different reasons. So the way that they make TV nowadays, movies, shows, is a little bit different than kind of back in the day. It used to be that, you'd have the actor kind of at the front closest to the camera, and then you'd have the background noise, the music, in the back. And so the sound of that background noise was never as amplified, and so the focus was always on the actor's speeches.
Mhm.
Now everything is digitized, and so the way that they're making movies, shows, there's 100 different cameras. The camera's moving, the voices are moving, the background noise is moving, everything is being digitized. So, it doesn't mean you've got an auditory processing disorder. It just means that that's just how they're making movies. that being said, I always recommend for everybody in the world from birth, to death, everybody should be getting a hearing tested every 2 years. I've got little children at home, and they've been getting their hearing tested every 2 years, and there's no concern, thankfully.
Yeah.
But every 2 years routinely, just like our eyes, we go
Yeah.
to the optometrist every couple of years, we go to the dentist all the time. It's part of our healthcare routine. There's no reason why audiology shouldn't be incorporated in that because hearing is a sense that we use all the time. We're using it now,
Yeah.
you're listening to me.
Yeah.
So,
Yeah. And the audience is listening to you as well.
exactly.
You make a good argument for it. And you're not just an audiologist, you also have your own practice, which means you're an entrepreneur. So,
Exactly.
what made you decide to go from working for somebody else to working for yourself?
Few things. When I graduated from my PhD, I loved clinical work, and I loved research, and I loved filling the gaps. And academia wasn't going to be an option for me because it meant doing a postdoc and traveling, and it's a challenging academic life when we were newly married, and I didn't want to do long distance marriage. And being able to open my own practice opened an array of possibilities as far as being able to incorporate processes and protocols to do audiology in the right way.
Mhm.
Really kind of empower audiology in a way.
Right.
I love that I have the power and the ability to innovate. I'm always knee deep in the literature, in peer-reviewed articles and looking to see, what's new out there and
Yeah.
what should we be incorporating as part of the practice in order to be able to do better,
Yeah.
so that nobody ever feels the way I felt for my grandmother.
Yeah, yeah, yeah. It's one of the things that attracted me to entrepreneurship as well, in the sense that I wanted to practice the way that I wanted to practice. I wanted to train the clients in a strong evidence-based way. But at the gym that I used to work at, I would write the program, and my manager would oversee the program.
Yeah,
And I thought, well, this is the latest in great science. She wasn't up to date on the science, so she would tell me you can't do it that way,
right.
or I have a different opinion. But I mean, I came with my receipts. I brought the research, the evidence. Uh,
And 100%. And I love kind of thinking outside the box. So one of the things that we do a lot is, I'll read literature from other fields. And we'll kind of look, is this something that we can incorporate? We'll often talk to our patients about music therapy.
yeah.
I'm not a musician. I wish I was, but I'm not a musician. But it's one of the things that we understand how music interfaces with the brain,
Mhm.
and how it strengthens some of those neuronal connections. And so being able to talk to my patients about that, that's not really audiology, but so we're kind of borrowing from other fields, and incorporating it into the practice. And it's something that I can do, which I love.
Yeah, yeah, that's the beauty of entrepreneurship. You get to practice the way you want to practice.
Exactly.
We touched on it a little bit, but what do you like most about being both an audiologist and an entrepreneur?
Definitely that power to be able to innovate and to always do things the way that it should be done or the way that I think it should be done. I have a really, really beautiful team at AudioSense, and I didn't realize this, but apparently today is Boss Appreciation Day,
Oh,
or it's tomorrow. And I walked in today and I got this beautiful, I don't know if you can see
yeah, yeah, yeah,
like this beautiful poster and these flowers and so just being able to work with an amazing team and
yeah,
being able to empower my staff to also kind of think about whenever you're with a patient, if they were your mom, your dad, your friend, your sister, how would you do the absolute best in helping them grow in their professional career?
yeah,
I love being able to empower the people that I work with. And lastly, doing stuff like this. One of my goals was always to be a thought leader
yeah,
in audiology. And it's something that, I got so bogged down into the day-to-day minutia of running the clinic and seeing, the patients, that I felt that I wasn't actually getting my thoughts out there.
right.
So more recently, I've been writing more blogs and I've been trying to do a little bit more presentations and just kind of, yeah, becoming that thought leader. So I
Yeah,
do love that.
absolutely. One of the best ways to become a thought leader is to write blogs, and even better to write books.
Yes, I haven't quite gotten there yet.
Yeah, yeah, yeah. It's not as difficult as people think. I've written 19 so far. Uh,
Really? Oh my God,
yeah,
that's amazing.
I have one more coming out, my 20th coming out next week. But yeah, I mean, like, and despite how, free information available on the internet, despite ebooks being all out there, 70% of my sales are print books.
Wow.
Yeah, yeah.
That's very cool. I might pick your brain about that a little bit later. I love writing.
Yes.
One of the things I loved when I was doing my PhD was writing those research articles, right? Like just write, 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 write. Before
Yeah.
I knew it, I had, I think my thesis was like 400 pages. And, to this day, sometimes I'll walk around and I'll show my parents and I'll be like, do you see how thick? Like it's just fun, but it's full of knowledge and information. And
Yeah.
every time I read it, even though I'm the one who wrote it, I learn something different. I can only imagine what that must be like with 20 books.
Oh, yeah, no, I mean that's one of my favorite parts about writing a book is the research that goes into writing a book because one of the best ways to become an expert on something is to just write about it. Even if you weren't an expert before, the amount of research that it takes to
Yeah.
publish a book, most of my books are over 100 studies. Um, so just to go through the process of writing a book to really solidify your thoughts on it, and not only solidify your thoughts, but to explain it in a way to somebody else who doesn't have a background in anatomy and physiology, makes you really really effective at that condition. For example, my book coming out is about osteoporosis. It's actually my second osteoporosis book, but that's how you become a thought leader. One of the ways is write a lot, and two, speak at conferences, sell books, etc. So you're on the right track.
Love that. Love that.
Awesome. And what do you do for marketing? How do you get new clients?
Marketing. We don't do enough for marketing. We don't do enough for marketing for a few different reasons. I mean, we definitely rely on our Google page a lot. We have a phenomenal digital marketing freelancer, our SEO
Yeah,
guy. His name is Anurag Parikh, and he's phenomenal. And we also have an amazing website designer
yeah,
Jessica Quash, and she's also great. And so we're constantly updating, and I know that they're kind of doing the stuff behind the scenes that I really
yeah.
don't understand. I wish we could do more marketing. Unfortunately, is expensive. It's very, very expensive, and it takes a lot of time, and it's expensive.
I hear you.
And so, as a small business, as an independent owner, it's hard to kind of break the market when it comes to marketing. More recently, though, in that spirit of kind of growing as a thought leader, I have been writing more blogs, writing more articles. I have a column that I write once every 2 months in the Canadian Audiologist.
Yeah,
Um, and it's a beautiful, beautiful journal, and it's run by the Canadian Academy of Audiology,
yeah,
which is an incredible organization for the field of audiology. And
yeah,
so that column, I think, we've been doing a little bit of that. Um, my socials, so I've embraced Facebook, LinkedIn, and Instagram.
yeah,
I'm older, and so I didn't necessarily grow up with the social media generation, and so it's
yeah,
all things that I've had to learn. But even just kind of learning, this is your handle, my AudioSense, and you have to use it
yeah.
everywhere. And so that's kind of what we've been doing.
Right.
Not a whole lot else, except though I will say. Whenever we see a patient, one of the things we do really well is we always write a thorough report and we send that back to the healthcare practitioner who referred that patient to us. So their family doctor, the
Mhm.
patient gets a copy of their own report. And we kind of think of the family doctor as the gatekeeper
Yeah,
of the patient's healthcare file.
yeah,
And so just sending back that report, seeing how thorough it is, I think a lot of the healthcare professionals really appreciate,
yeah.
and in turn end up sending more patients to us.
That's a great way to go. So of all your patients, what percent would you say come from doctor referrals versus other patient referrals versus SEO versus social media?
Lots of word of mouth. That's big. That's probably our biggest referral source.
Yeah,
And audiology, our clinic specifically, it's self-referral. So somebody wants an appointment, they go on our website, they book an appointment. There's an online portal, or
yeah,
they pick up the phone, or send an email, right? So a lot of it, a lot of word of mouth.
mhm,
I think the second next would probably be just Google, people just finding us.
yeah,
We are finding that whenever somebody leaves us a review on our Google page, our phone rings tenfold.
Interesting.
Unfortunately, our regulatory body doesn't allow us to ask for the review.
Right.
So every time a patient leaves, we kind of, we cross our fingers, we hope and pray that they're going to go home and write us a beautiful review and we can thank them later.
I
But
know
it
that
makes a huge, huge difference.
I know that you're not allowed to ask them for reviews, but the way and that's the case for a lot of practitioners, massage therapists, naturopathy doctors, etc. The way they get around it is simply the receptionist asks for a review.
Yeah, I've always been a little bit because I'm the owner and I'm the audiologist.
Yeah.
And so I guess I have to look at the rules and I have to ask my regulatory body. I don't know that we're allowed to do that either in
Yeah.
audiology. Mostly because I own the clinic, and so it's an audiologist owned clinic by an audiologist, and so the rules are a little bit more stringent than if the clinic were owned by, a business person that had nothing to do with audiology, unfortunately, because
Okay.
you can't regulate the non-audiologist person, right?
Yeah, yeah, exactly, exactly.
Yeah.
Understood. Yeah, I mean, yeah, marketing can be challenging. It can be expensive. And when I was starting in business, I had very, very little money. I was in like 23 at the time. And so I was always looking for ways to market myself that didn't cost me anything. I spent nothing and I got clients. So my ability to spend grew. And at first I just started off with public speaking. It cost me nothing. I got clients sometimes right away, sometimes a few, a little down the line. And occasionally even got paid for public speaking. So that's a great way to do it in a way that doesn't cost you any money. Um, Even right now, when I do my marketing, um, so there's four strategies that really bring in new clients. One is public speaking, one is email marketing, one is writing books. So it's not just I don't just write books for book sales on Amazon, but also to bring in clients.
Yeah,
And four, believe it or not, door-to-door sales.
right.
So two of those four are completely free. Door-to-door sales and public speaking are free. Books are inexpensive. It costs me about $200 to $400 to publish. Um, and after, so the way I think about it is first you can use free marketing methods to bring in clients. After that, I don't think of marketing as expensive. I think of it in terms of return on investment calculator. If I spend $1,000 and I get zero, that was expensive. If I
Right.
spend $1,000 and get 2,000, that was very cheap. That's a great trade. And if I can make that trade for 1,000 for 2,000, like if I can make that trade, I'll do it all day long. Problem is, it's the uncertainty. You don't know if you spend 1,000, are you going to get back 2,000? So what I'll do is just advertising alone, not other forms of marketing, I'll typically spend between 100 and 120,000 per year, um, buying different ads. Some of those ads will work and most won't. Like 80% will not work. But my winners, I double down on. I spend 60 to 80% of my advertising budget on proven winners and then the remainder just on testing new things. Maybe I'm always playing a game called Beat the Winner. Okay. Um, I'm looking at what other ad can I buy that would produce a return. And again, at first I was super scared to buy ads because yeah, the uncertainty. Maybe I spend 1,000 or 2,000 or 5,000 and get nothing. But because I was willing to take a chance, fortunately, my first one was a winner. I think I just lucked out on that one because if my first one was a loser, I'd conclude advertising doesn't work. My first one was a winner, and then I thought, oh, how can I do more of that?
Yeah.
My second one was also a winner.
Wow.
My third one was a loser. My next 10 were losers. But the fact that the first two were winners, that really emboldened me to advertise more to figure out where. And now I actively look for places where can I spend advertising dollars that will at least test, but hopefully succeed at bringing in some kind of return, either immediately or at some point down the line, even 10 years down the line, you know?
Yeah,
Um,
absolutely.
yeah,
My husband also has his own startup. He developed a SaaS company. It's called ManageMate, and
yeah,
it's basically a software that allows condo boards and condo managers to manage and run their condos.
yeah,
And so he's always, he's kind of got that business entrepreneurial nature, and he's a little bit more willing to take risks.
yeah,
And he's always the one that's saying, yeah, you don't think about it as an expense, right? Like it's a return on investment because it
yes,
comes back to you. But for me, I was trained as a clinician, and I'm not a gambler, and but it's a mindset shift for sure.
yeah,
And it's definitely something that I've been doing more of,
yeah,
more recently. Um, and then the speaking engagements, 100%. Last year we gave a talk, I gave a talk at the Ontario Brain Conference, and it was on concussion. Concussion is one of the the newer areas that we're getting into.
Yeah.
And it's actually been extremely exciting because not a lot of clinics, hearing health clinics in Canada actually will work with individuals who have concussion.
Yeah.
And we do. And so I gave this talk to kind of, address, the reality of somebody who has gone through a sports injury or motor vehicle accident.
Mhm.
They will often suffer from auditory symptoms,
Yeah.
like the tinnitus, which is ringing in the ears, hyperacusis, which is sound sensitivity, so a sudden sensitivity to loud noises that they didn't have before, auditory processing issues, and it's something that's often dismissed because on an actual hearing chart, we call that an audiogram, their hearing is perfectly normal.
Yeah.
And so they get dismissed by many audiologists. And so when we gave that talk, I mean, it was beautiful and it made so many connections. And so definitely more public speaking, getting more patients in, getting ourselves more out there is important. I
Yeah,
agree
yeah,
with
that's
you.
a great way to go. Listen, if I was dropped in a new city and I didn't know anybody, I'd start public speaking. I'd
Right.
approach corporations, community centers, etc., clinics, and so on, where I could speak. And like you, my background is kinesiology. In kinesiology, they don't teach marketing and sales. For me to get to advertising took actually 10 years into my business. Because a little backstory, most of my business was built with a combination of public speaking and email marketing.
Yeah, okay.
COVID, when I couldn't speak to a public anymore.
Right.
Then I thought, and that killed two things. Most of my email subscribers came from my public speaking engagements. So with one fell swoop, it killed both the public speaking side of things and the email marketing side of things. So I thought, oh, how can I grow my email list without public speaking? Then I thought,
Mhm.
well, I know I've tried advertising before, but with like Facebook and Google, but that wasn't working. Let me try different forms of ads. So that's when I went out on a limb, bought my first ad, and that's when it worked. And then that was 10 years into my business. And then I thought, man, I wish I had done this earlier. I wish I had done this when I was just starting out. I would actually put like taking the risk and put some money into advertising. Because up until that point, I did put some money into like Facebook and Google advertising, and it wasn't working. So I just dismissed it.
Right. Yeah. Yeah, for sure. I'm embracing those social media channels. Google, we've been advertising there since the beginning,
Yeah,
100%. But not so much the social media channels. And so we're doing a lot more of that. And it's actually been a lot of fun, especially with all the tools that are available nowadays.
yeah,
I mean, I'm not super tech savvy, but I create my posts in Canva, and
yeah.
you can really make some beautiful stuff. I feel like an artist every time I'm in there and like adding pictures and like
Yeah.
changing the fonts and I'll do it at night after the kids go to bed, and it's so much fun.
Yeah, yeah. It could be a lot of fun if it's profitable.
Right, yeah.
Otherwise, it's just a creative outlet, which is fine if you treat it as such. But I've been volunteering for the Markham Small Business Center for 9 years so far, helping entrepreneurs grow their businesses. And I've seen the full gamut of social media from businesses where it works like gangbusters to businesses where it doesn't work at all. For
Right.
example, my business doesn't work at all. Social media is horrible. Colossal waste of time. However, for businesses like restaurants, clothes, stuff like that, it's fantastic. It can really drive business. What I found with social media is that if your business is high cost, high commitment, like personal training, obviously, social media is terrible because it's by definition personal training and social media is impersonal. Um, on the other hand, if a service or a product is low cost, low commitment, social media works great. For example, a restaurant, even an expensive restaurant, is only expensive compared to other restaurants. It's
Hmm.
compared to personal training. And it's low commitment. If you eat at that restaurant, you never have to go back there and dine again. There's no membership card. Nobody's forcing you to go
Right.
back and eat at
Yeah.
the restaurant. Same thing with clothes, etc. Once you bought your pants at Lululemon, you never have to go back to Lululemon. Um, so for those kinds of businesses, social media is great. For personal businesses, not great. And I always encourage entrepreneurs to actually have a mark for success. How do you know it's working? And the ultimate way to know is sales. In personal training, if you ask the average trainer how you get new clients, they'll tell you social media and referrals. And if you press them on it, how many clients do you get with social media? I asked one trainer, he says, a lot. I said, how many? He says 10. I said, over what span of time? He said, 3 years. I said,
Mhm.
that's horrible. That's three clients per
Mhm.
year. And how much time did you spend on social media? Oh, an hour a day. So he spent 365 hours to get three clients. So
Yeah.
120 hours per client. That's horrible, horrible ratio. I can speak for 1 hour and get three clients out of that. Much
Yeah.
better ratio.
Yeah, for sure.
But the reason a lot of entrepreneurs do it is because they see other entrepreneurs doing it and they see the numbers of likes, followers, and shares. But what they don't see is the most important thing, the bank account.
Right.
And it's what they call incestuous marketing. You do it because you see other people doing it, but you don't know how
Right.
they're doing. You just know the
Yeah.
likes, followers, and shares. But bottom line is it getting clients? Is it putting money in bank, not likes, followers, and shares?
Yeah, fair enough. I mean, we're fortunate that our word of mouth is definitely our biggest source of marketing.
Yeah,
The Google, right? Like hitting high on Google and
yeah,
kind of getting to that first page, especially when we get a review. And then our doctors, we have a lot of healthcare professionals
yeah.
that'll refer to us. Family doctors, occupational therapists, chiropractors, psychologists, physiotherapists, and ever since we got into um, the concussion space, seeing concussion patients for, hearing health issues, I feel like we've actually gotten significantly more referrals.
Awesome.
And it's just been great, but it's also because we've expanded our service offerings and now we're doing something that nobody else is doing.
That's
Um,
fantastic.
and we're incorporating, the healthcare provider, right? So um, it's very common for somebody who has had a motor vehicle accident to be assigned a caseworker. Sometimes it'll be an occupational therapist and sometimes not. And, if that person needs help or support during the appointment, they will ask, can we attend the appointment with you guys? And we
Yeah,
celebrate that because,
absolutely.
absolutely come in and that way there's, more people to listen to the recommendations and then we do things as a team, and we love that so much, and it's been so successful for us.
Yeah,
So yeah, so that's been a lot of fun. The post-concussion services is, it's newer. We've started offering them since 2021,
yeah.
but it's been something that we're really focusing on growing.
Yeah,
So
that's amazing. So if you found two things that are already working for you, I would just figure out how to do more of that. More,
yeah,
more referrals from existing patients, and also more referrals from practitioners.
right.
That might be much more effective for you so than social media. Although you should still spend maybe 5-10% of your time seeing if you can make social media work for a period of time until you've concluded, yes, it works. Let me spend more time on that, or no, it's not working. Let me stop it completely.
Yeah, fair enough. Yeah.
But ultimately, up to you. Um, what are you working on right now that's exciting to you?
A few things. So we're always kind of working on our processes and protocols. And so the concussion bit, I think, is probably the biggest one. But it's interesting because individuals who have suffered from a concussion, usually it'll be a motor vehicle accident or so car accident or a sports injury, and they will come to us and they will often be suffering. I think I mentioned that earlier from ringing in the ears, sensitivities to loud sounds, difficulty hearing a noise, headaches, blurry vision, like you name it. There's so many other symptoms. And so it's actually been great to be able to work, with other healthcare professionals. We're a very collaborative clinic. And so we'll
Yeah,
often call, a vision therapist and say, we have this mutual patient. This is kind of what we saw. This is what we think. Do you think the same thing? How do we do better? Speaking with a psychotherapist, we'll often refer there as well, just to get some support and so that we know we're not doing things in silo.
yeah,
And so really kind of growing our network of healthcare professionals that we can collaborate with.
yeah,
So that's a big thing that we're doing now, enhancing those protocols. Because there's not a lot in audiology that tells us how to how to provide the right recommendations and the right interventions for somebody who suffered from a concussion. So again, that's where
yeah,
we embrace the literature and we embrace what's happening in other fields,
yeah,
and implement it as part of our protocols and make sure that we do everything as a team. So
yeah,
it doesn't matter whether it's myself or one of the other audiologists seeing the patient. We will always have team meetings and we'll make sure, okay, did we do all of this? And do we all agree with the recommendations? And sometimes somebody will say, well, I feel like maybe we should try this. And then we'll call the patients and say, we should try this.
yeah.
And, it's always successful to do things as a team.
Oh yeah, it's nice to that if a patient comes in, they're not just seeing one person, they're seeing that person, but there's an entire team behind that person, all thinking about the same problem.
Exactly. There's so many brains, right? Kind of contributing and thinking, right, about that one person and trying to think of how can we do our best for this
Yes.
person.
Yeah,
The other
exactly.
big thing that I'm also working on is, my goal is to grow. And so, always wanting to grow, open more clinics in different parts of the city, different parts of the country, different parts of the province.
Mhm.
So, I feel like that's something that I always kind of have my ears and my eyes open to because I want our services to be accessible.
Yeah.
Um, yeah,
Yeah. That's always an exciting thing to be working on, additional locations as well as additional services.
exactly. Yeah.
And what obstacles have you encountered in your time, both as an audiologist and an entrepreneur?
I mean, you're an entrepreneur yourself, so I mean, the challenges, the obstacles, I mean, they're always there. I think one of my biggest ones is the lack of control.
Mm.
There's so much that we can control as, our protocols, our billing, our staff, our reports, our
Yeah.
office management software. We can educate our patients, but we recently had an experience where we had submitted an application, a claim for a patient. For services and products, and it was accepted by the insurance company, and so we offered all of our services, rendered all the services, dispensed all the products. We go to bill the insurance company, and the invoice is declined.
Mm.
And so now you're chasing, right?
Yeah.
You're calling and you're trying to figure out, why. And in this particular example, the patient had hearing loss, and it was a motor vehicle accident, and so we did dispense hearing aids, and so they're very expensive, and so we can't be out that money, and so we don't want to take it away from the patient because they're so successful with it and it's helping so much. So the chasing, I think, is
Yeah.
very, very challenging. Things that are out of your control. With hearing aids, for example, we will often, if somebody has a hearing loss and we recommend a hearing aid, we have a demo program where we basically let our patients borrow one of our hearing aids. There's so many different brands and types and styles.
Yeah.
And sometimes, they won't know what's appropriate for them. We don't even always know. We
Yeah.
typically have a good inclination, but no two hearing aids are the same and no two brains are the same. And so sometimes it's important to actually be able to try a few different brands before
Yeah.
you commit. Um, and so, we'll have a patient that'll try all these demos and now they're motivated. They're like, this is the one I want. I want it, in the champagne color
Yeah.
and I'm going away on Monday, so can I have it by Friday? And so we're like, yes, no problem. You place the order and it's back ordered. Or, the postal company goes on strike or like it's just things that are out of your control. Um, that's been challenging.
That's a frustration of every entrepreneur. Like we like to be in control, we like to do things the way we like to do things, but sometimes there are external factors.
100%.
Yeah.
Yeah.
And besides being an audiologist and an entrepreneur, what do you do in your free time?
Well, I've got a wonderful husband and I've got three amazing kids. I've got two girls and a boy. And they're little. They're 9, 8, and 1. So lots of time spent with them. I'm very, very fortunate that most of my family is in town. So my parents, my in-laws, my sisters. And so we'll often have rummy night with my parents. My dad loves playing rummy. So we will literally be playing rummy until 3 or 4 o'clock in the morning until we're like, okay, Dad, it's time for us to go to bed now, and he's ready to keep going. So definitely, a fun activity, board games, rummy. And then I'm really into puzzles. So I have a wall of puzzles at home, and I'll put a puzzle together, and then I'll glue it, and then I'll frame it, and then it goes up on the wall. So I choose them carefully. I need to make sure it goes with the decor.
Yes.
Currently working on a 2,000-piece puzzle. It's panoramic photo by Alexander von Humboldt, and he's a phenomenal photographer.
Well,
And so that's kind of what I do.
I hope I'm not the only one wondering, what is Rami?
Rummy. Oh my gosh. It's like there's different types of rummy, but gin rummy, Bombay rummy, it's a card game.
Okay, okay.
So you play with three decks of cards, and everybody gets 13 cards. And there's all these rules, and they
Okay.
vary depending on the type of round, but it's a lot of fun.
Okay, so it's a
And
card game.
it's a card game, yeah.
Okay, good, good. Okay, now I get it. Okay. And since this is after all a Best of Markham podcast, what's your favorite business in Markham besides your own?
You know, I was thinking about the answer to that question, and it's hard because I love so much about Markham.
Same.
I love Main Street Unionville.
Yep.
And so I find that we're often going on strolls there. I live downtown, and so, getting to Unionville isn't always easy.
Mhm.
But we're often going there, and I Halo Crunch. I mean, my kids love the charcoal ice cream there.
Yeah.
So it's been a lot of fun. I'm actually one goal for me for AudioSense is to actually have a location in Main Street Unionville, except there's nothing available for lease. So if something comes up, if anybody wants to lease their property, let me know because I'm I'm ready. Um, so love Main Street Unionville. And then across from our Markham Clinic right now, actually, there is a beautiful pho. It's called Thai pho, and it's phenomenal.
Yeah.
And they make this amazing tom yum. I keep calling it pho, but I think it's actually pronounced pho.
Oh, yeah.
Yeah, my husband's always correcting me, but love that restaurant. So
Yeah, so many great cuisines in Markham. I actually had a guest on here in the past. He happens to be the owner of two of my favorite restaurants. One is called Glass Kitchen on Leslie Highway 7. The other one is called Pears. But even in Main Street, Unionville, I thought for sure you were going to say Smash Kitchen. Because I think four of my guests so far who don't know each other all said Smash Kitchen is their favorite business in Markham. It happens to be in Unionville.
oh, that's so funny. I Halo Crunch is my good that charcoal ice cream. I love it. And then my mom will always drag me to Pretty Little Things. It's a jewelry shop in
Yeah,
Main
I
Street,
know.
Unionville.
Yeah, yeah.
So yeah, no, it's just a fun, it's got a fun vibe. I love it.
Yeah, yeah, I love Unionville so much. Like, there's different parts of Markham that I love a lot. I love Thornhill. I love Unionville. I love East Markham.
Yeah.
The old downtown Markham. Like, everything has its charm.
Yeah, absolutely. I mean I grew up in Markham, and so it's always you know it's always a pilgrimage, whenever I get lost in like a little neighborhood in Markham and seeing how much it's grown and developed, since we were kids. So yeah.
Especially the new downtown. Like, you used to go by there with just an empty field. Now it's got, Cineplex. It's got great restaurants, new campus of York University. So much to do there.
I know. And I think is it there that they're moving the Honda Indy next year?
Maybe. I'm not up to date on that one.
Yeah, I think they're moving the Honda Indy somewhere near downtown Markham. So that'll get loud. So hopefully we'll get more visitors to AudioSense when people need some earplugs.
Excellent, excellent. You should be sponsoring the Honda Indy.
I know, I think we might be.
There's an idea for you. Well, thank you so much for being here, Salima. Tell our viewers and listeners how they can get in touch with you.
So, a few different ways. I think the important thing to know is our services are self-referral, so you don't need to wait for a doctor's referral to come see us. The easiest way is to just go on our website, so www.audiosense.ca. And then there's a booking page, so you can book your appointment directly through our website, or you can email us through a contact form, or you can just jump on your email us at info@audiosense.ca. You can also call 905-946-9664 or 416-901-4770. We're very good at being able to accommodate same week appointments, sometimes even same day. And I think that's been kind of a game changer for a lot of patients, particularly with wax removal.
Mhm.
Um, you wake up, you feel a little bit plugged up, and you're like, oh my gosh, I have to wait a week for an appointment. No, we can get you in right away, and we make it a point to leave some appointment slots open so that we can do that for our patients. So just call, email, come see us for everybody in the world.
That's perfect. And all your contact details will be in the show notes as well. Salima, once again, thank you so much for being here. I really appreciate it.
Amazing. Thank you so much, Igor.
Good thing.